my name is Dr. Boski Nair. I'm a consultant perinatal psychiatrist working in a community perinatal team in Kent and Medway. And I'm going to talk about perinatal anxiety disorders. Anxiety spectrum disorders can affect 15 to 20% of mothers and fathers in the perinatal period. When we are looking at symptoms of anxiety disorders, they can be physiological symptoms, which means that they can impact on the person's body. These includes feeling lightheaded or dizzy, pins and needles sensation, feeling restless or unable to sit still, having headaches, backaches or other aches and pains, faster breathing, a fast thumping or irregular heartbeat, sweating or hot flushes, insomnia, changes in sex drive, or having panic attacks. We find that sometimes people can experience psychological symptoms which affects the person's mind. They can feel tense, nervous, or unable to relax, have a sense of dread, unable to stop worrying, wanting lots of reassurance from other people, worrying a lot about things that might happen in the future, having ruminations, which is thinking a lot about bad experiences or thinking over a situation again and again, experiencing depersonalization, where they feel disconnected from their mind or body, or like they're watching someone else, or having the experience of derealization, where they're feeling disconnected from the world around them or feel like the world isn't real. Often we find that people with anxiety symptoms can be irritable. They could have fears of fetal or baby's well-being. They could worry about maternal wellness. They could have worries about illness in the partner or parental mortality. We often find that anxiety and depression can coexist during the perinatal period. So if we are thinking about treatment modalities for women with perinatal anxiety and they're presenting with persistent subthreshold symptoms, consider facilitated self-help. If they're presenting with mild, moderate symptoms, low-intensity psychological intervention like facilitated self-help or high-intensity psychological intervention such as CBT can be offered as initial treatment. Local maternity or third sector organizations can help provide specific counseling or group programs to help with anxiety. In addition, it is important to suggest online CBT, self-help books, physical activities, relaxation techniques, support from health visitors and peer support groups. Often we find that some women require medications to help address anxiety symptoms. If they are experiencing severe distress and or impairment, then medication may be required, often in combination with psychological therapy. SSRIs or selective serotonin reuptake inhibitors are the most commonly used class of antidepressant medication in the perinatal period, and they are used in anxiety disorders as well. So when do we refer women with severe anxiety to secondary care or specialist services? If both medications and CBT have not been successful, the woman's daily activities are being severely affected by her anxiety, or if there are other associated risks such as suicidal ideation, intent or thoughts to harm others, referral to the local specialist perinatal mental health service or community mental health team should be considered.